So I'm Sonya, and I'm a naturopathic doctor, and 5 years ago I opened up a clinic on Palace Road near the Kingston Centre, and we have 10 practitioners, including four total naturopathic doctors, and osteopaths and massage therapists and psychotherapy and some other services. And this is clearly the time of year to talk about the immune system and immune system function and inflammation, overactivity. It's a system-wide concern that really does affect everybody, and such a hot topic right now. There are three main points that I'd like to get across today, in addition to the typical, more practical pieces that you can use to apply in your health this winter. One is that the immune system is part of inflammation. We have this idea in Western medicine, or I guess for us, a lot of us just think about immune system deficiencies and colds and flus, but really when the immune system goes off, we need to think a little bit more about immune system balance. And when the immune system is overreacting, as in allergies or asthma, or when it's not reacting optimally so that we have inflammation, whether chronic low-grade inflammation causing chronic pain, and a whole system-wide series of concerns that put our immune system, or are an indication that our immune system is at risk, and then so we are at risk for acute opportunities like colds and flus that can take us out for some time, and some people don't recover quite well from. The other one is that the gut is, the digestive tract is the main center of your immune system activity. If your gut is working well, then your immune system can't work well, and your immune system will not become optimized until your gut is working quite well. And the third point is that stress is one of the major mediators over whether your gut can retain that immune system function or not. Stress mediates immune system activity through the nervous system, which affects the gut, which houses our immune system. We need to take care of all of these pieces if you're going to have a really good chance of not only warding off the colds and the flus, but also the chronic headaches or the chronic joint pain or the arthritises or whatever it is that ails us these days. Okay? So the first little part of our handout today, the signs of immune system deficiencies or imbalances. Really pay attention to prevention this winter if any of these really apply to you. Colds or flus 3 times a year or more. We should be able to acquire a cold or a flu maybe once a year and fight it off in a few days without serious repercussions. Not feel fatigued or tired for weeks to come, like a lot of us are. Not acquire a secondary infection, not have it turn into bronchitis or pneumonia or hospitalization. That is hard to recover from and is a real drain on our whole body. If you have an autoimmune disease in which theoretically the immune system starts to attack parts of our own body, that frequently is low thyroid function. A lot of people aren't aware that low thyroid function most commonly is an autoimmune disease, or some forms of arthritis like rheumatoid arthritis or ankylosing spondylitis, skin disorders like psoriasis, MS, a lot of neurological disorders they believe have an autoimmune component. So these are all considerations for how the immune system has become imbalanced and a risk factor for all these other pieces we're discussing. Asthma and allergies are signs of where the immune system is overreactive, and quite often we're just not talking about low immune systems, we're talking about immune system balance. So if you're deficient on the one end and more susceptible to bacteria and viruses and those bugs that you don't want to take up house in your body, you're also more susceptible to an overreactive part of the immune system on the other side. That's when you start to attack foreign things that your body should have lots of tolerance for. Different foods, different environmental pollens, that kind of thing. All right. And then principle number 1 is where we come into the chronic pain, the mental health concerns, and chronic diseases like diabetes and history of cancer. This is where the immune system really is a spectrum illness that includes systemic inflammation. In Western medicine, traditionally we've considered that inflammation just occurs when we have an injury. You have a scratch and it starts to ooze, and that's your inflammation, your immune system trying to heal that wound through the process of inflammation, or infection, like a virus or a bug. But we now know that tissues all on their own and organs, like your liver, like your heart, can send out signals of inflammation all on their own. When they are not working optimally, when their function has become a little bit compromised because it's overwhelmed with hormonal changes or dietary changes, for example, stress, then they can send out little signals that trigger the immune system, and that puts us all at risk. So our traditional view of the immune system and treating it with inflammation blockers, NSAIDs like aspirin and naproxen, it's on the way out, really. The future of medicine has no choice but to start to address inflammation from a system-wide perspective and recognize that it's not just about these single little tiny chemical pathways that we need to block with these drugs. Right? It's multi-system, it affects all organs, and its chemical processes occurring all over the body. And by blocking the immune process with the drug, there are lots of unintended consequences. Like, for example, we know that there are these pathways that help to resolve inflammation in our body. And a lot of the drugs that we use actually block these immune pathways that resolve inflammation. We don't know what the consequences are of that directly. It hasn't been well studied yet. This is newer German research. But this is also why we end up with a lot of side effects from the anti-inflammatories that we tend to take, like aspirin causing gastric bleeds, for example. Most people know that if you take too much of that kind of thing, you can end up with bleeding in your stomach. All right. Inflammation is considered really to be the underlying cause of a lot of chronic illness that we experience in our society, like diabetes, like cancer. When you're diabetic, your immune system is suppressed, and so you are also more at risk for colds and flus. When you have cancer, it is the immune system's job to find all those cells on a regular basis and scoop them up and get rid of them. And if the immune system isn't able to do that, a tumor can progress, for example. Put down here depression or anxiety and a family history of mental health concerns. That's newer research as well for mental health conditions not being caused by changes in serotonin or dopamine, for example, neurotransmitters or brain chemicals. All of those brain chemicals, in fact, are shifted because of underlying inflammation. And some people have genetic susceptibility to inflammation. In order to make the inflammation, they steal chemicals that would otherwise become something like serotonin, for example, to help their mood. So if you don't get at the underlying inflammation, you don't have an effective treatment for something like depression or anxiety for a good number of people. Okay, so if you have depression or anxiety with a family history, if you have a chronic illness or chronic pain associated with inflammation, all of this suggests that there is an immune system imbalance already present, and that puts you at risk for colds and flus and some of the other more superficial things that we're interested in preventing this winter, particularly because you're more at risk of it becoming a complicated illness, not just a cold that resolves on its own. Okay. Other more common symptoms include swollen lymph nodes all the time. If you end up with skin infections like boils or infected acne, lesions, that kind of thing. If you're prone to recurrence of chronic viruses like cold sores or shingles or warts, that's a virus that's present in the body that for some reason your body isn't getting rid of. Why is your immune system not getting rid of that, and is there something we can do about that, and what does that mean overall for your immune system balance? Okay. And if you're fortunate not to have any of these immune system deficiencies or imbalanced signs or symptoms, then let's look at the next section, which is about who's still at risk. And it also gives you an idea of how much effort should you really put into supporting your immune system function this winter. The first major one is any kind of digestive illness. And that could be acid reflux, it could be an autoimmune disease like Crohn's or ulcerative colitis, irritable bowel syndrome. A lot of people end up with that kind of alternating between constipation and diarrhea, or just an inability to regulate the bowels, which is has a system-wide effect. If your bowels are not working well and you're not absorbing nutrients very well, and you're not able to eliminate all the junk that your body makes for you very easily, that there are many obstacles present there to developing an optimal immune system. And most importantly, with the digestive system, are most people familiar with the idea of probiotics? And have you heard the term gut microbiome? And they know now, and they have for some time now, that the body is made up of 10 times more bacteria than cells. And even if bacteria have 10 times more genetic makeup than we do ourselves, we're 10 times 10 walking genetic material, DNA, that's bacteria rather than human. Far more bacteria than human. And these little guys exist primarily in our gut, which is where a lot of our immune system activity exists. And the good guys, so to speak, are just good because through evolution we've depended on their junk, their metabolic byproducts, to tell the immune system there how to be balanced. It teaches the immune cells whether to attack or not attack. It teaches them to be tolerant of the good guys or not. They produce nutrients that keep the mucous membrane. That means your whole lining of your gut, for example, keeps that integrity intact. If your mucous membranes aren't healthy, then inflammation is really common, even in the nose, chronic sinusitis, that kind of thing. The bad guys, so to speak, are just the bad guys because we didn't evolve with them. They have no use for us. They take up all the nutrients and space that the good guys require, so we don't get those chemicals that tell our immune system how to function. We don't get those chemicals that are nutrients for us. We end up with nutrient deficiencies because the mucous membranes are not intact and we can't absorb things as well. And all of their byproducts tend to be like a toxin that we have to get rid of, no different than our own cellular metabolism. Our cells go through metabolism, and they produce junk and waste that our liver has to eliminate. And so the gut is pretty critical. If you have an optimal gut, your body can do a lot. If after a series of antibiotics, for example, which kill off a lot of the bad guys, it's their intent, but also the good guys, and if you're not very aware of how to put those good guys back in or encourage a great environment in the digestive tract to harbor and encourage the culturing of those good guys, then you end up with predominance of bacteria that have no place being there and system-wide disorders that slow progression towards chronic illness through inflammation. There even brand new research came out in September that said that somehow the bacteria balance is even triggering mood changes directly, not even through stealing the nutrients that otherwise would make serotonin, for example, which is what inflammation does, but these guys somehow either through a nerve that connects the gut to the brain or maybe through other hormones that they make directly. The gut actually makes 95% of the body's serotonin levels. The gut is pretty important for mental health in that regard. But these guys somehow encourage sugar cravings or fat cravings, depending on the balance that's there. And we've studied a lot of different kinds of autoimmune disease and gut bacteria, and we see particular shifts in gut bacteria with people in autoimmune diseases, and we can link that to different genetic changes that somebody carries or that's inherited. And that this genetic change plus this change in gut bacteria seems to make you so much more susceptible to the development of an autoimmune arthritis, for example. That's even older research, and we've just come to understand the critical role that these gut bacteria play in our immune system function, and then therefore inflammation, and then how inflammation affects chronic disease. But we are just barely at the cusp of understanding how do you actually protect your gut. And we need to spend a lot of time figuring out how do you keep those good guys there. If you take an antibiotic, what do you do about it? Probiotic is quite critical, but the quality of the probiotic is still challenging and not common knowledge at all. There are a lot of bad probiotics out there, including yogurt companies who find a bacteria and patent it in their product, and people take a heck of a lot of it until everything is thrown off, thinking they're doing something very good for their body. Right? It's not that simple, especially where the gut, and this is one of the other main take-home messages I want to come across, is that stress through the nervous system really affects the ability of the gut to function. A lot of the organs in the body are innervated by, have you heard of the parasympathetic and then the sympathetic nervous system, the relaxed part of the nervous system, and the fight or flight part of the nervous system? And the gut requires a significant amount of that parasympathetic nervous system balance. You need to be relaxed in order to digest food. Relaxed to tell the body to make stomach acid, break up that food, create a pH or a certain acid level in the gut to encourage the good growth of those good bacteria. And if we're in a chronically stressed out place, then the gut doesn't work very well. We end up with acid reflux or bloating or constant constipation or diarrhea, and the nutrient deficiencies that further put us at risk just because of stress, particularly stress that has been chronic, even if it's just a little bit. Because physiologically, our bodies work very well in acute stress states. We evolved to get away from quick dangers, like a tiger running after you. Your body physiology shifts to allow you to get out of danger very quickly, but there's a cost. And the cost is fine if it's just a short-lived danger. You can heal up from that. But if it's just a little bit of danger on a regular basis, and your body has no way of really distinguishing between acute stress and chronic stress, and you never have a chance to shift back into that regular metabolism, then your body goes through requiring a lot of nutrient that it otherwise wouldn't need. So you develop nutrient deficiencies that your body needs, that your immune system needs, for example. And the body will take those nutrients that it's left with to survive, put them towards processes that you need to survive at the expense of other processes in the body, and you develop symptoms in certain places. In this way, the idea of chronic stress is, and then chronic disease because of it, it's a very wise adaptation by the body, a very wise compensation by the body to survive and get as far as we do in life. But we aren't recognizing the consequences yet, and we don't know how to, we're not in a culture right now that practices getting out of that fight or flight state, that chronic stress state, protect our gut and our immune system so that we don't end up with symptoms or chronic disease. Okay? So certainly nutrient deficiencies can put you at risk. Diet is huge. Sugar can really suppress the immune system. They know that ingesting just a little bit of sugar, even equivalent to a can of pop, will suppress your immune system activity for a few hours after having that. And that depends on the study that you look at, but some studies say 50% more likely for that virus or bacteria that you're harboring to become a real problem for your body. It just takes those few hours plus the stimulus, a bug, for it to become more rampant in your body. So really keeping sugar down to a minimum, and that includes the chemical sugars like aspartame and NutraSweet, all these kinds of things. There's plenty of research now to suggest that that is really affecting your bacteria balance in your gut, and it's associated with diabetes, it's associated with obesity, lots of different considerations. So stay away from those as well. Get used to just a little bit of sweet. Some of the natural sugars are not. It's still sugar and sweet, but if it's done in balance, that's fine. Vegetables. Those are your antioxidants. Those are the nutrients that block inflammation, well, not block inflammation, but support inflammation through to completion, for example. We don't want to block the immune system's attempt to heal something through the process of inflammation like the drugs do. We want to help the immune system do what it's intending to do and finish the job so that it doesn't become a chronic low-grade problem and chronic pain. That's what a lot of the nutrients in vegetables do. The phytonutrients, they call them, and the other vitamins and minerals. If you use a regular digestive medication, like an acid-blocking drug, for hopefully clear reasons now, that puts you at risk of immune system imbalances or deficiencies. And we know that people who are on chronic use of an antacid, for example, they are more likely to get different illnesses. They've studied that quite well. Steroid medications, like cortisone, even hydrocortisone cream, that blocks the immune system. That causes immune system suppression, and long-term use of these kinds of pharmaceuticals can also put you at risk. And then at the bottom here is a really big one, sleep. Most of us know that sleep is good for us. I don't know that a lot of us really understand why. You've perhaps heard of melatonin, the hormone that's made at night when you're sleeping, and it's an incredible antioxidant, incredible. It's very key in breast cancer prevention, for example. And it's one of the reasons why the World Health Organization calls shift work, in which your melatonin levels are kind of all over the place, a risk factor for cancer. Sleep through the production of melatonin, but also for a whole variety of reasons, which includes promoting healing processes in the body. That's when your body has a chance to finally regenerate and do some other things. That's pretty critical. Okay. I included at the very last page of this handout 10 tips for sleeping well that you can go over perhaps on your own. Just easy things that you can do by yourself to encourage that more deep, restful sleep, which means more optimal melatonin production and regeneration, so that you can face your day a little bit more easily and improve your whole resiliency against disease, which is what we want to do today. So this includes keeping room entirely dark, get your circadian rhythm on track. Light shuts off melatonin, so expose yourself to some good sunlight or seasonal affective disorder type full spectrum light first thing in the morning, and then at night make sure it's completely dark. Body temperature plays a big role in how well we sleep. You need to be warm in certain places, cold in certain places. It's a very interesting place to research, so that's all here. Electromagnetic radiation is something that a lot of people don't consider as something that inhibits sleep. But electromagnetic radiation, there are a lot of people who are sensitive to it. And Canada and the United States are of the very few countries still that consider it not a problem to address. There is some amazing research happening in a lot of European countries, Germany, that says people are severely affected by electromagnetic radiation at times. So that's the consequence of cell phones, cell phone towers, anything in an electrical outlet. And we know, for example, that some really interesting studies with teenagers who keep their cell phone right by their head of the bed, and then the risk of them having ADHD or difficulty in school. Some really interesting research there, for example. Okay, so there's some information on our website if anybody's interested on sources of electromagnetic radiation, how to decrease your exposure by keeping phones a certain distance away from you, by keeping your alarm clock a certain distance away from your head at night, for example, to encourage that deeper sleep. Blood sugar and blood sugar highs and lows. Most people are familiar with what a blood sugar crash feels like. Some people get anxious and jittery, other people get very angry. I know some couples who say that before an argument with their partner, they'll make sure they've eaten so that it goes much more easily. And at nighttime, we fast for a very long period of time, and people who have had slow changes in their ability to keep blood sugar levels at a very stable place, they're much more likely to get a crash in the middle of the night, and it wakes them up. 3 o'clock, they always wake up, for example. That's something to consider, and how you eat through the day to stabilize your blood sugar levels so that you can sleep more easily. Relaxed muscles, because muscle tension tells your brain that you are in danger in some ways, so making sure that that's addressed, whether through nutrient deficiencies or other ways of relaxation. Trying not to keep your mind busy right before bed if you can, avoiding stimulants like caffeine, for example. Some people are very slow metabolizers, they call them, of things like caffeine. They inherited a gene that makes a wonky enzyme in the liver that just works on caffeine very slowly, so it stays in their system for 12 hours or more. And you think you might have had that cup of coffee late morning, but it could still affect you at night, for example. Sleeping pills, I think, can be a great short-term solution, but in the long run, they really do affect your ability to go through the natural stages of sleep and that regeneration capacity and melatonin production. So there are consequences for sure to long-term use of sleeping pills, and they do not enable your body to experience the benefits of sleep that it could acquire otherwise on its own.
It does include melatonin pills, people take them?
No, I mean like Valium or those kinds of drugs. Sleep apnea is also a very common condition that a lot of people may have and don't recognize. And to be diagnosed properly with sleep apnea, you do have to go to a sleep clinic, and in Kingston, depending on your symptoms, the wait can be 6 months or a year or a little bit longer. Okay. So some nutrients. I'll go quickly, if I can, through some of these options. Things that you can do, a plan that you can have ready. Make a plan for if you are exposed to an illness. Somebody has a cold or flu and you've been exposed. Have a plan ready so you can implement some guidelines to try and not get sick. Have a plan for if you already are sick. Have a plan for if you're sick and you're getting more sick. These are all nice things to have so that when you are brain fogged and exhausted, you don't have to work too hard or get to a store to find something to help yourself out a bit, or explain to a partner exactly what it is you're looking for and they have no clue. You know how that goes. The key to finding the right nutrient, though, is understanding your body and matching it very directly to your own susceptibilities. Any nutrient is only as good of a match it can be for your body. Right? It doesn't really matter sometimes the research, it will take a look at zinc or vitamin A and its ability to ward off the cold and flu, and who knows what the outcome is. Sometimes it says great, sometimes it says, well, there's absolutely no evidence at all. But they don't evaluate the people in these studies for deficiencies of that nutrient already, or for other patterns that say that this nutrient is going to hit a heck of a lot of different symptoms together, and therefore it's a good match for the person. So it's all about the match. So for example, probiotics. The quality is critical. It's, I believe, quite important to find a professional brand that does their own research on their own probiotic strain in people. So they haven't just gone through the literature and found one kind of bacteria and they put it in a pill and expect that it's going to work as well. You don't know if they've cultured that bacteria very well, if it's going to last on its way down into your gut, if it's going to culture at all. You need to know that kind of information, and why waste your money on a brand that might put on the label that there's 10 billion in there, for example, but they don't guarantee that it's 10 billion by the expiry date, or that there's any left in there after shipping. And then you go to Shoppers Drug Mart and you find these probiotics sitting on the shelf rather than in the fridge. And you find marketing promotions and labels that say this is shelf stable, you don't need to put it in the fridge, but it's a bacteria. It will last longer if you put it in the fridge. And there's lots of things to consider here. And probiotics and fish oils, I think, are really good baselines no matter what, because of their capacity to keep the gut healthy and inflammation at bay, and because the inflammation is present in so many people. It's a nice preventative practice regardless. But in terms of protecting your immune system going into the winter time, it's a particular consideration for you if you've had recent antibiotic use or chronic antibiotic use at some point in your life, or if you have some digestive concern that isn't adequately managed, or chronic low-grade inflammation in the mucous membrane like chronic sinusitis, or if you're susceptible to something like that, a probiotic becomes more important. Take your probiotic with food. Some companies still suggest that you take it away from food, but that's really old research. We know that the bacteria are much more likely to stay in your gut and culture on their own if you have other food in there to shift and buffer the stomach acid. Okay. Vitamin D is a very big one. Most people are familiar with the concept of vitamin D. A lot of health practitioners in all paradigms are recommending a little bit of vitamin D, particularly in our area. They believe that it has to do with how much sun we're exposed to, for example, and since our sun exposure is one of the main ways we acquire vitamin D, and since we are taught to wear sunscreen at all times and not go out into the sun generally, a lot of people are becoming vitamin D deficient. there's a lot more to the story than that, and vitamin D isn't, I don't think, still quite well researched for how it affects individuals, and there are dozens and dozens of metabolites of vitamin D and how our body uses, it's a hormone really more than a vitamin, and we have one blood test for one metabolite to tell us how well we're doing, so that's okay. But I think 2,000 IUs a day is good advice for the typical person. There are some people who will recommend up to 10,000 or more, and I think we don't have enough research to say that that's safe. If you have any signs that you don't absorb fat very well, like a gallbladder issue, or you avoid greasy food because it throws you off, then you may have a difficult time absorbing vitamin D from your food as well, or vitamin D supplements, so be aware of that when you're trying to figure out how much vitamin D to take. I do think having a lot of vitamin D to support your immune system as part of your plan when you're exposed or just starting to get sick can jack that up for sure. 6,000 units divided in a day with food for most people is safe and healthy for 1 or 2 weeks, and can really work well to give your immune system that quick shot, that quick support that it needs to mount up a response against that bug and calm it down to completion. Vitamin D is metabolized in the kidney and liver. It's activated in some ways by these organs, so if you have a kidney or liver concern, you want to pay particular attention to whether you're including vitamin D in your plan. If you have an autoimmune condition where the immune system is imbalanced, vitamin D plays a critical role in balancing autoimmune illnesses. For the most part, there are some exceptions, but that's another consideration. A bone condition, because vitamin D is required for absorption of calcium, for example. So, or a skin condition, just because theoretically then you're not able to absorb vitamin D nearly so well. Vitamin A. Be cautious with vitamin A if you may become pregnant, because it can cause birth defects. And the precursor to vitamin A, beta-carotene, which is all those yellow vegetables, that's very safe no matter what, but only about 1/6 of that will become the active vitamin A, so be aware of that. If you've got little bumps on your arms, some people just get a lot of little red bumps here, or even on their thighs, sometimes that's associated with a vitamin A deficiency. If your eyes are sensitive to light at night, that can also be a sign of vitamin A deficiency. If you have, again, fat absorption concerns, like with vitamin D, vitamin A also becomes a concern. Zinc. There are a lot of, you can find zinc lozenges all over the health food stores to help a sore throat. They tend to work quite well. And zinc, if you've ever taken it, tastes very awful. Awful, awful. But when you have a cold and the immune system is working so hard there to deal with the virus there in your throat, it's going through a heck of a lot of zinc, and you're zinc deficient, and you tend not to taste the zinc lozenge. And maybe you'll taste the vitamin C that they add to the lozenge, and it tastes great until your sore throat starts to disappear, and then you want to spit it out the first time you take it. And the only bit of caution with the zinc really is that if you take it on an empty stomach, some people are really sensitive, and because zinc helps to stimulate stomach acid production, you might feel a bit nauseous if you take it on an empty stomach. Okay?
But the latest thing about taking zinc to absorb too much copper in your system?
To absorb too much copper? Well,
People keep sending me emails about that.
well, zinc, if you take a lot of zinc, it can deplete copper. Minerals act in antagonistic ways, they say. So a lot of zinc means lower copper. If you have a copper excess, too much copper, Wilson's disease, for example, something like that, some people will treat that with taking high doses of zinc. And some supplements at the health food store actually include a teeny little bit of copper to try and prevent that imbalance from occurring. But zinc lozenges or zinc just for a short period of time, a few weeks or a couple of months, should not cause any kind of imbalance, especially if you've got a well-rounded diet, which is pretty critical in all of this. Signs of zinc deficiency to match to yourself include things like eczema or strange skin rashes. You need zinc for your skin. Cuts that heal slowly, that's a big one. White spots on the fingernails, not from when you've banged your hand and you get these big white spots, but a lot of people have tiny little white flecks all over the place, and that's one sign that could be related to zinc. Difficulty digesting meat, because you need zinc to make that stomach acid, and a heck of a lot of people who are stressed out don't make that stomach acid, And sometimes it's related to a zinc deficiency, and you have a difficult time breaking down protein. So if meat just kind of throws you off, a good steak, you have a difficult time breaking down some of those meatier things because they're in the stomach acid. It could be correlated to a zinc deficiency. And then finally, zinc is one thing that also helps your sense of smell and sense of taste. So if those two things have started to go, sometimes it's a zinc deficiency. Okay. I put on here some essential fatty acids or omega-3s, fish oils usually. There are some other sources, but fish oils are one of the easiest sources for your body to use. And it would be wonderful if we could get what we needed from fish. Some people that is all they need, but if there is a lot of inflammation in your body, taking a supplement rather than from fish is quite important because fish is so unfortunately contaminated, either with heavy metals if you go for the wild caught stuff, or PCBs and pesticides if you go for the farmed stuff. It's a really unfortunate state, but fish oils are very important immune system modulators because of one of the main ways that they balance inflammation is by changing the balance of fats in all our cells. Our cell membranes, all of our cells they're made of fats. And if they're predominantly made of fats from meat and animal products, a fat called arachidonic acid, your body takes that arachidonic acid and makes inflammation. But if your cells are made up of these omega-3 fatty acids, there's no precursor to the inflammation, and in fact the cell works a lot better. That membrane is a lot more fluid and it has a lot more adaptability and can address its environment a lot more easily than if it's a rigid cell membrane like what the arachidonic acid makes.
Then flaxseed is for vegetarian. Is that official?
Yes, flaxseed is a wonderful source of essential fatty acids, but some people do have a difficult time converting it into the active form. So that's why they've come up with a lot of algae sources, for example. I don't know that there is a wonderful vegetarian source. That's maybe why some fish oil companies have come up with wonderful sustainability plans for people who are vegetarian for ethical reasons. They contribute substantially to proper farming practices, that kind of thing, and reduce packaging waste, environmental sustainability. But maybe look at the algae sources over the flax, or flax has other benefits for some people, depending on whether they have skin disorders or perimenopausal, that kind of thing. Vitamin C, that's a common one. Particularly if your blood vessels are showing signs that they're a little bit weak. You bruise easily, you hit yourself and your blood vessel breaks and you get a bruise, or you get nosebleeds, or your gums are really sensitive to flossing and you bleed. That's sometimes a sign of vitamin C deficiency. And stress goes through a lot of vitamin C. The immune system requires a lot of vitamin C, so that's another place where stress and the immune system are linked. The adrenal glands, which make all your stress hormones for the most part, they need a lot of vitamin C, and I'm told that humans are the only species that don't make their own vitamin C anymore. Most animals do. So we're expected to get it from our diet, but very few people get enough in their diet really for the kind of lifestyle that we tend to lead and the amount of stress that we're exposed to. And then finally, I picked 2 herbs here, although there are hundreds of amazing immune system supportive herbs that are part of Asian medicine, for example, which goes back 2,000 to 5,000 years, sometimes longer. So they've used these well, and they know the exact pattern of a person to match that botanical to. Sometimes we'll take the astragalus, for example, and we've done so much mainstream research on its ability to affect this inflammatory chemical or that inflammatory chemical, how it affects cancer, how it affects immunosuppression and other certain diseases, and how amazing it is. But research is always quite varied when it comes to something like a botanical or nutrient because they're not applying it with the same philosophy that these older medicines did. Astragalus is for a very qi deficient person, for example, from a Chinese medicine perspective. Those are tired, worn out, cold people in some ways, so exhausted. It's an abstract concept that you can become familiar with. Compared to rhodiola, that's the next herb that I chose on the list. It's an old Scandinavian herb, and it's best matched to somebody who's hot excess. It's somebody who is stressed out. The mainstream research often applies it to people who have a lot of chronic stress, who could anticipate a lot of acute stressors in the future, like exams, family traumas, that kind of thing. The rhodiola is quite amazing to help students get through that, and it was one of my best friends for quite a few years. So those are 2 herbs you can find at the health food stores, and just don't be cheap with your botanicals. Spend a little money or do some research on the good products. I like Green Door Vitamins downtown. He's been in business for quite some time and offers a lot of good product down there. Okay, and then finally, just some other little tidbits to consider. Number 1 is that fever is really good for you. Fever is one of the few ways that your body heats up to fry up those viruses and bacteria, and if we're chronically trying to suppress the fever because it's uncomfortable, then you are at risk for harboring a low-grade chronic illness. That's common. There is definitely a place that you do want to suppress it, because you can start to damage your own body, your own proteins, rather than just the virus, for example. But that number is different for everybody. Some people say 104. I'm more comfortable, particularly with children, at around 102. It depends on your tolerance and what your body temperature started out as. Some people are just very cold. So going from 97 degrees regularly up to 102, that's a large jump. You might want to cut it off at 101, for example. Okay. Children, hopefully most people know that Pediatric Society, mainstream medical recommendations in general say don't use the over-the-counter antitussives or cough syrups or other flu remedies. They're not meant for children. They're not studied well in children. And immune system suppression in children, I believe, does have very real potential long-term consequences. The immune system is developing, and we're intentionally pushing it in another direction. What does that mean later on for how well the immune system can prevent allergies, asthma, cancer, autoimmunity, that kind of thing? So look for the natural health products, because those have been used for hundreds of years, some of them, and the nutrients in particular, maybe not the fat-soluble ones. You have to be careful of those, because too much of that is stored in the body, like the A and the D. There's a limit to that. But the water-soluble ones, like vitamin C, you can tend to go quite high in a child when they're sick. And diarrhea is one of your signs that they're not absorbing it anymore. It's too much. They don't need it. Diet, that is key to getting through the winter. And maybe I haven't emphasized it enough through some of these other pieces. But it's a challenge always, of course. Keep hydrated. Have lots of water away from your meals, separate from your meals, so it's not affecting your digestion too much. But have lots of water to keep mucous membranes moist so that they can fight off illnesses. You've got a different kind of immune system in the mucous membranes. It's called IgA. That fights off bugs, so water's important for that. You can even use a humidifier at home to keep, especially at night in your bedroom, to help keep everything moist. And it's quite shocking sometimes how much of a difference that makes. Colds and flus go right down for a lot of people when their humidity level in their home is a little bit better. Avoiding the sugar. Sometimes when you're really mucousy, some people are very sensitive to dairy and orange juice and other things that encourage mucus production. So if you're ever prone to sinusitis or ear infections, tiny little places where mucus production would clog things up even more and allow bacteria to kind of sit there. You want to avoid these things when you're sick for a short period of time. Dress warmly. A lot of people, old wives' tale that you're going to get a cold if you go outside with shorts in the wintertime. But it really is a stress on the body, and the stress affects the immune system. And there was one funny study that said up to 12% more colds developed in participants who were exposed to a chill. Really interesting. And in all the older medicines, they get this. They know this for different types of people. Some people can handle it quite well. Are you a hot person or are you a cold person? It's the pattern I was referring to earlier. And the only other tiny pieces that I might mention is to breathe deeply, relax, stimulate that relaxed part of the nervous system. Then you have proper gut function, and your immune system has more capacity to cope with whatever it's dealt with. Resiliency is much, much higher in people who know how to shift into that relaxed part of the nervous system. Be aware of environmental chemicals, things that you use in your home, heavy metals, cleaning products, processed foods and preservatives, all of these things that are an extra burden for your body to bear at times when you're already trying to deal with so much else. In Chinese medicine, your liver, which is really part of the digestive tract, is one of the kings of the immune system. You need it to function and eliminate and process all this stuff going through you, your own hormones, your own wastes, the wastes from the bacteria that shouldn't be in there, but also everything you breathe in, everything that goes in your skin, all this stuff it's expected to get rid of, and it's a huge obstacle to a balanced immune system if you're taking in too much, or if for whatever reason too much is going on for you and you can't handle it all at the same time. It's about a threshold and keeping within a certain guideline depending on how much is going on in your life. Relationships, there's a lot of research out there suggesting that people who have good solid social networks and relationships are much healthier, much more likely to ward off illness, which is kind of funny because mainstream medicine focuses so much on not contacting other people for spread of the bug, right? Wash your hands, cough into your elbow, not your hand, that kind of thing. But the social relationships, I do believe overall, are far more important than even exposure for a lot of people. It's part of the major difference between integrative medicines and Western medicine, which is that the bug is the problem to treat, kill it, avoid it at all costs, versus everything that we're talking about today is support the body and the terrain. Your immune system can do all of this far better than any drug can, and it has the wisdom right there inside you. You don't need a physician to tell you how to do that, or research Google to tell you how to have that immunity. So keep your body healthy and it will do it for you, and then you don't have to worry so much about going out and enjoying yourself when you know that a certain flu is moving around. And teeth. Teeth are very commonly associated with lots of chronic inflammation and chronic diseases in our bodies, and we neglect them. There's a lot of bacteria in the mouth, and they can go off quite easily, and there's a different kind of immune system there even. So pay attention to if you have a little bit more cold or hot sensitivity. Is there a little bit of an infection in there that you really need to deal with? Boost your immune system. Is there an old root canal that never quite healed properly? Lots of reasons to believe that taking care of your teeth will benefit your immune system overall. Okay, I think I left just a few minutes for questions. Yeah.
It mentions about keeping hydrated to potentially use a saline rinse or a neti pot. First time I ever used a neti pot was just a cold I had a few weeks ago. It's a very strange experience, but it was good. But as a preventative thing, how do you use it? Like, it says daily, but how long before? Only when you have symptoms?
It works much better preventatively than as an acute treatment, I find. Because with an acute treatment, if you don't really know where things are at, you do risk sometimes shoving more bug through the system. And a lot of cultures practice using a neti pot, or you go to the pharmacy and get those squeezy bottles that come with saline packages so it doesn't look like this weird teapot thing that some people are just a little bit hesitant to use. Doing that daily, every morning or every night, it's like brushing your teeth.
So part of your daily routine normally?
Yeah, particularly in the wintertime. It keeps everything hydrated. The salt is antimicrobial, so it helps support the sinuses and the nose from that perspective.
Yeah, well,
Yeah, it's
that's
clean.
good to know that it's actually good to use it as a daily thing like brushing your teeth, because a friend of mine just used it when she had a cold or something like that.
A lot of people do, but I find you've got to be very careful about where you're at in the cold, and if you're too congested, it just makes things feel a lot worse. So preventatively, the saline rinses are much more useful.
Sonya, is it also a danger of overdosing on vitamins if you're not, I mean, you know, sometimes I see people take a handful, you know, and I think, is there a danger of doing that when you really don't know the action, because the body's so complex? You know?
Yeah, absolutely.
Isn't it just natural to try to get good food and, you know, the natural things instead of popping all these vitamins all the time?
Absolutely.
Yeah.
A lot of people believe that because it's a natural health supplement, particularly if it has an NPN number from Health Canada, therefore it's safe rather than the pharmaceuticals. But you absolutely can do damage, I think, with a lot of these things, which is why Health Canada is pulling more and more off the health food store shelves. And mainstream medical practitioners are not adequately trained in how to use these nutrients. a lot of nutrients are just useless at the health food stores too. The quality isn't there. We might regulate them for purity, make sure there's not anything particularly dangerous in there. And Health Canada will evaluate research in order to decide, well, what claims can somebody put on this bottle for what it does. So they do offer some safety net, but there are so many people who just keep adding more and more and more without targeting the actual problem, and it's not going to be any better than any drug. It's more about finding exactly for you what you need, keeping it simple, and the nutrients I consider usually are a means to an end. Diet is key. Your body knows how to recognize those nutrients. These supplements are synthetic, made in a laboratory like anything else. We don't consider that with chemicals and fillers and things to compress it into tabs. It's something that we have to consider. And do it with the diet, although stress does, I did mention earlier, changes physiology, so you go through a lot more vitamins sometimes, and there are certain ones that I don't think we can adequately get from diet, given our typical lifestyle.
Thank you. I recently started taking oil of oregano just for my general health, and the gal in the store said that I should take probiotics along with it. Now, why is that?
Oil of oregano is a very potent antimicrobial, which means that it kills bacteria and viruses and a lot of other things, but it also potentially kills your own good bacteria, which is what the probiotic is there for. Because like taking an antibiotic on a regular basis.
So they should be taken together then, or should they be alternated?
I would do them at different times of the day. But I also don't recommend oil of oregano chronically. Oil of oregano is very potent, very strong, and there are strong chemicals in it that I think can cause damage to our cells when used long term. So using it here and there through the winter, particularly using it when you've got a sore throat, a few drops on the tongue, if the burn doesn't bother you too much, if it does, put in a bit of olive oil or something like that, and it's great to ward off the sore throat. It's nice when you're developing a plan, consider something antimicrobial like oil of oregano to kill the bug. Berberine is another really nice one. Garlic is onion. Garlic maybe is a little bit more common, and you can find the extracts, but they're stinky. Take something like that, and then take something immune supportive, like the vitamin D or the herbs. Know where your deficiencies are and how to boost that immune system. Keep the lifestyle stuff stable. Keep the stress down, monitor your diet, cut out the dairy and the sugar when you're feeling ill, and that's a pretty good, well-rounded plan.
Yes, I take oil of oregano when I feel a little something.
Me too.
That's right. No use taking it all the time. You just need to take it when you like when you feel a little something, so that it won't turn into anything serious.
Yeah, I agree.
But there's some old remedies, like if you have a bit of a sore throat, gargle with apple cider vinegar diluted and drink it. I'm telling you, I know that because when I was pregnant, I didn't want to take anything, and I was flying from Europe, and it was a lot of stress. So I went to my doctor, and he did a swab, and he said, after 3 days, you can have your antibiotic. I said, I don't need it anymore. I treat myself with apple cider vinegar.
Oh, wonderful.
Very simple thing. I
Yeah.
ordered many students
Yeah.
on the counter when they came with sore throats or they're sniffing. And it works really good when you do it right in the beginning.
Yeah, a lot of it is about catching it early
Yeah.
before it goes out of control. Yeah,
Just a little bit like this and a glass of that,
Yeah.
and
wonderful.
Question. So, if you recognize a problem such as stress, and it's situational, and you notice that you have immune deficiencies related to that stress,
Yeah.
are you okay? What would you recommend? You mentioned an herb regarding stress. Do you take something for the stress, or should I be taking something for my? Do I need to do both stress and immune, or you know what I mean? So do I just focus on the stress, or do I do both, or do I just do immune? You know what I mean? If I know that the stress is going to be there irregardless, and it is situational.
Yeah, I think it's the safest plan and simplest plan is to support the stress balance first and do that chronically throughout your experience of the stress and maybe a few weeks beyond, because most people know that's vacation is when they're most likely to get sick, for example, when their body relaxes. there are so many herbs to do that. They call them adrenal stress hormones or adaptogens like rhodiola, and here's one of my favorite ones. Do a low dose of that regularly, and then have a good plan for when you're just starting to feel a little bit ill.
Okay.
And don't be afraid to do that every 2 weeks if you need to, that little bit of a plan. Yeah?
Thank you.
Anything else?
Well, my herbalist says it's good to take, a quarter of a cup of water with half a lemon every other day, and every other day a tablespoon of vinegar. And my crafting teacher says that when you have a cold, you can do water, lemon juice, ginger, and honey, as my herbalist recommends taking daily during the colder months.
Lemon in water is an old trick for keeping the whole system in balance, really. It
And
goes-
honey.
And, well, the lemon
Visit.
in
I
water,
mean, visit, then it's not so.
yeah.
Yeah, but you can drink it, it's not.
So you can use it as an acute remedy for sure. Ginger is very anti-inflammatory. The honey, if it's raw honey, has other nutrients in it that are known to balance the immune system, the antimicrobial. So those are wonderful tricks. The lemon in water has benefits well beyond that to just keep the system in balance in general. So doing that on a regular basis is nice. Yeah.
I want to know whether using your laptop in bed will like make you not be able to sleep.
But would not be able to make
Like typing on your laptop in bed in the night because it's like bad for sleeping.
That's classic for a lot of people, unfortunately, yeah. Yeah, it's the brain stimulation, it's that kind of light coming off of the laptop that keeps things going too much. So if you have difficulty shutting down your brain in order to sleep, or some people shut down way too easily. They're too tired and they need a lot more sleep than they're getting. And then there's the potential implication of electromagnetic radiation and having that sitting right on you and what that does to the nervous system. But there's a bit of a gray area there. So yeah, I would say keep it in the dining room or living room. different compartment of the house. Yeah.
Yes, I think I know your answer, but just for the kick of it, flu shot, yes or no?
Oh, that's tough.
I mean,
Yeah.
why do you say it's tough? I don't think it's tough, and say no. And I mean, you know, they go down now in age, and so there are so many kids who are supposed to get the flu shot. They're never going to develop an immune system
Yeah.
well enough to fight a cold.
Yeah.
But I think, you know, if you are on the other side of it, one should be much more outspoken about it. And warn people against these shots.
Yeah. The mainstream medical community pushes it quite strongly, and it seems to have crossed a line with marketing so that it's a little bit more fear-mongering than almost any other technique in Western medicine or medicine here in Ontario in particular. And there's very little consideration for individual risk. And what we do know about the flu shot, for example, is that the CDC, the Center for Disease Control, evaluates certain flu strains over a period of time. They choose one that they think is most likely to be the problem for the year, and that becomes the vaccine. And quite often they're wrong. They pick the wrong one. We also know that in order to have an effective immune response to the vaccine, in order to gain the benefit from the vaccine, you have to have a healthy immune system. And the people that are given the flu shot most often are those people considered most at risk, have a deficient immune system, so their reaction to the vaccine is already most deficient. And in children, that hygiene hypothesis, or the idea that we live in such a sterile environment, they don't have the good cultures of bacteria to tell their immune system how to be balanced. They're already deficient and showing signs of immune imbalances. The flu shot potentially has consequences from that perspective too. So there are a lot of drawbacks, I feel, to the flu shot, but it really is a very individual and personal choice. If you if you work in a place with a lot of people who are sensitive and susceptible to complications from the flu, like a nursing home or a hospital, then you really have to consider the flu shot and prepare your body for it so that you don't have a lot of consequences from it, and that you develop a good immune response to it. You can do things to try and help your body eliminate all the junk that goes into a vaccine, if you like, so that just in case they picked the right strain, or even if they didn't, if somebody gets sick, you don't have to feel concerned that that was partly your fault. There's a lot of blaming in our culture
That's right.
regarding flu and illness. Mm-hmm.
Because then if you got the flu shot, you could show that you got the flu shot.
Mm-hmm. You did what you did, potentially. You did what you could do from a mainstream medical perspective, even though there really is so much more that you could do. And the one thing I did mention in the handout, and there's more immune system information on our website if you're interested, but there are lots of studies to say that adequate vitamin D levels are more protective against the flu for most people than the flu shot. And so you could get your vitamin D levels tested if you want. The lab test isn't covered by OHIP anymore. Too many people were using it, and so they cut it out. But the labs reduced the price of it so that it's about $35, whether your MD or your naturopathic doctor, ND, orders it for you. And use that as a guide to how much vitamin D to take, whether it's 2,000 or 4,000 or what have you, or use your symptoms as an understanding of how much to use. Yeah.
That's a personal question. My hip is killing me. I'm taking, aspirin and anti-inflammatories, and it's not working. Is there anything? It's chronic.
Well, it's probably because the aspirin blocks the pathway for your immune system to heal.
That can
Yes,
be part
lots
of
of
it,
people
yeah.
do take aspirin when anything's hurting, including my
Yeah.
father, but it blocks the pathways.
The one thing
essentially.
about drugs that block the pathways, they work quickly and very well. Aspirin, naproxen, those kinds of things, they should cut the pain quite well. There's just a cost to it. And part of that cost is about neglecting to address the underlying cause, and how does that low-grade inflammation progress? What does it turn into? That depends on the person. But if those drugs aren't working, then
Usually the chiropractor, it cures it because it starts grading, and then I get information from the grading, and then.
that's just it. So you've
And
got to find either.
This time it won't stop. It just won't.
Sometimes, especially if it's the right hip, for example,
Yeah.
you have to start being concerned about radiating pain from the intestine, radiating pain from the gallbladder. That's a very common consideration where if you're used to a hip having been out, you just write it off as it's my old hip pain when it's really something else going on. And that's where if all the other tricks that you've used haven't worked, still aren't working, that's when you've got to look a little bit more deeply. But otherwise, if it is just inflammation in general that has caused degradation of the joint and the cartilage isn't there, you can do things like take nutrients that help support healthy cartilage tissue. You've got to find the source of the inflammation. The problem isn't the hip. The problem is inflammation imbalances or immune system imbalances in other locations. Quite often it's the gut. It's stress. You fix the gut. The body has the ability for some people to shift so that inflammation comes right down, so that the hip doesn't become so much of a bother, so that the inflammation doesn't eat away at the joint and progress into what we all expect is just a typical experience of aging. It doesn't have to be that way.
Yeah.
So it's hard to say how to treat a hip when you need to see the whole picture.
That,
Yeah.
it's very complicated.
Yeah.
Can you say something about people who use antibacterial products all the time in the kitchen, in the bathroom, detergents, soap, even oral
Yeah.
products?
Yeah, we've gone way overboard, I think. And a lot of the chemicals in these products we know affect the hormone system. They're called endocrine disruptors. And I've met a lot of dental hygienists or nurses, people who use that stuff 20 times, 60 times a day sometimes, with thyroid issues, estrogen dominance and risk factors for breast cancer, for example, and all this research is there, but so often in Western medicine we expect that the benefit from killing the bug or avoiding that illness so outweighs the potential cost, which is the illness. We don't see the collateral damage very easily. The fact that it's an endocrine disruptor, or that we're entirely ignoring the terrain of the body. We're focusing so much on killing the bug and avoiding the bug that we ignore as a medical society the probiotics, the the good bacteria, keeping those good bacteria on your hands, which take up space and fight anything that could come along otherwise. Your skin has so much bacteria that you need. So
Is there a movement within the medical society or different alternatives teaching people about how to use the bugs, how to live
Yeah, there
with
is a book out.
the microbes that were colonized with, completely. People think it's scary, to know they have
but they're
bugs around
not
them.
sterile.
I
Yeah.
have friends who use a lot of antibacterial products, and
Yeah.
I can't convince them that it's not good for them.
I
There's
think,
a book
yeah.
out now. It's called The Germ Code.
Oh,
It's written by a microbiologist, and it's really interesting. It's a little technical in the beginning, but afterwards it's very interesting. She could read that from the library. There is a long list. I was number 40.
Yeah, okay.
Germ Code.
It's a new book coming out.
Rather, well, not that past
Well,
2 years ago.
usually the library buys several copies. and
Yeah,
they
yeah, they do.
yeah, I think
It's to
that
live with it.
Education.
we're getting
It's
there
to live with the
slowly.
germs. That's what she is.
That's my
Yeah.
point. We have to learn how to live with. We have to learn more about the life of it.
But even you hear this on the radio, different doctors are saying this antibacterial soap is no good. Yeah, they do say it. Yeah, so-
but then on the other hand, they use it all over.
Well, I don't know where.
There's
You know,
a
All you enter
definite time
hospital
lag
and so on.
in research. There's so much research to say that it is very harmful. But like any good research in medicine, different studies will say 17 years, sometimes 20. Some will give the more optimal or idealistic view of 7 years. It takes a heck of a lot of time for that research to become embedded in medical practice, in philosophies that actually translate into benefits for a patient. Huge time lag. So I think that's part of it. So give it 17 years and we'll see these changes. Yeah.
But what do you think the other, like the shingles, and there's so many shots now you have to have. Like, do you feel the same way?
What about those?
Because there's 4 parenting now that there's a woman every year.
She's asking about other shots like shingles and things like that.
Other
She's asking about
vaccines.
other shots, like for shingles, to prevent shingles, things like that. Yeah.
Yeah, that shingles is of course quite painful, and I know a lot of people who will choose to have the vaccine in hopes of not acquiring the illness. And my major concern perhaps is just about using that in lieu of recognizing shingles as a sign of immune system deficiency. So again, you're ignoring the underlying cause and putting yourself at risk for so much else. I think if you are educated about your use of the vaccine and you prepare your immune system for the vaccine and you use it when you're healthy, the risk is minimal, especially because most people who will choose to have the vaccine are older, their immune systems are developed, they're not developing like in children, and it's just about timing, really. Don't get it when you're feeling ill, that kind of thing, if you're going to choose to do that. If you have a family history of autoimmune disease or complications from vaccines, really consider maybe not having it, or be prepared for if you do have an adverse reaction, because they do happen.
How long it takes for your immune system to be fully developed? At what age?
A good part of the immune system isn't finished, they believe, until about the age of 7. But with childhood vaccines, a lot of experts who try to evaluate the immune system shifts from vaccines are suggesting that after the age of 2, you're safe to do most anything within reason, or at least after the age of 1. But there are so many opinions out there, and really have to take into consideration the health of the child and their risk factors. Are they breastfed? Are they at daycare? That kind of thing.
Yeah, I have another question. You mentioned these 2 drugs, the one Chinese and the other one the Scandinavian, not drugs, excuse me, but herbs.
Yeah.
Which foster our immune system. Isn't there something closer to home? I mean, I'm always concerned also in our eating habits. If the green doesn't grow, probably we don't need it. that much.
In some ways, yeah.
Yeah.
Yeah, there are burdock, for example. We have a lot of botanicals that support the lymphatic system. The lymph system, which takes all the junk in your body and helps you eliminate it. And interestingly, they tend to grow in environments that are really toxic. Swamp areas or industrial areas like burdock is one of the major ones.
How about horsetail?
Horsetail is more known as an astringent or a kidney support. It has a lot of silica for fingernail growth and all those kinds of things, which are related to kidneys in Chinese medicine. So there are a lot of beautiful herbs that are local. And if I thought about it a little bit more, I could probably think of some really good immune-stimulating ones directly, or supportive ones. We don't necessarily want stimulating, but supportive ones that are local, like dandelion is incredible. But most of the herbs that I can think of that are local are much more supportive of the whole body as opposed to directly to the immune system for what we're talking about today. And certainly by saying Chinese or Scandinavian, I don't mean that they are shipped from those countries or grown just in those countries. We can, a lot of those herbs we can culture here and harvest them here. And so much of our environment are invasive species or species not native to our area at all.
I've got enough burdock on my property to
supply all of us.
the whole Canadian population, so feel free to come and dig on my property anytime.
So what, dandelions?
Burdock.
I got two, burdock and dandelions.
So how do you make it tea or what?
Well, the dandelions I just eat green. You know, I eat the green.
Oh, you eat the green.
Early on.
Okay.
And the burdock, no, I have not really touched them. Except that I have them on my clothes when I go into the woods. But yeah.
It's the root, though. Yeah. Boil up the root. That's what a lot of old cultures do.
And apparently they taste like parsnip. Yes, I have had them once. It's good, yeah, but you know, to dig them out. Now, I have another question with regard to cod liver oil, which primarily you only get in capsules nowadays, and the ones I have bought, finally was able to buy them, they somehow take the taste away, the real cod liver oil taste. Now, I don't mind it because I take it and then drink some milk right after, and it doesn't bother me. While the capsules talk back to me. And there's something in the capsules, and I told the pharmacist, I don't want to put that jelly stuff into my stomach. Why should I?
Some people,
I don't want to have it processed.
I know. You can find liquid cod liver oil.
Oh yes, I found it at you know, twice as much as the ones that I usually got from Canadian sources.
Yeah, and you can only put so much oil in a gel capsule. A gel capsule takes up a lot of space, so quite often a teaspoon of the liquid compared to the gel capsule, you end up saving a lot of money by doing the liquid if you can manage the liquid.
Yeah, but the pharmaceutical industry does not. You know, they think differently. They put everything into a capsule and then charge 3-4 times more.
With pharmaceuticals, it's a very interesting marketing culture with different colors and sizes for Canadians versus Americans, for example. It's all about what we're more inclined to take or not. A lot of people I know will not do the liquid, even if it is maybe healthier, more easily absorbed without all the junk and costs less. They still won't do the liquid. But yeah, the only other thing I had to suggest about the cod liver oil too is that it's particularly helpful in the wintertime because of the vitamin A and D in it, which means that it has less of the omega-3s in it. Or fewer omega-3s. So it depends on your own system balance, which one is a better one for you, but I would not rely on cod liver oil on a daily basis as a regular supplement because that can be too much vitamin A or D depending on the quality of the product.
Well, you only should take it in the wintertime or in the months with R. That's what my mother always said.
Oh yeah.
That's interesting.
Yeah.
In the news, I was reading the news, and the past few days there was a debate that some of the researchers were saying flu shot should be given, or some of the saying it's not necessary. What do you think about that?
She came
late.
Oh, sorry, it's okay. I will.
We'll ask. Yeah. Was it American? I'm curious, is it American news or Canadian?
Actually, I was reading, I think it's a global mailbox. I was reading online.
Yeah, they give a lot more vaccines in the States to younger children than here in Canada.